Hello, everybody. As Nick said, you'll have seen the artwork, hopefully, at the front and the pull-up banner up there, Life's an Itch. The Psoriasis Association, one of our aims is to raise awareness of psoriasis, as you all know. And we do find that itch is something that comes up time and again. People do find that, their psoriasis, it really itches, but find that it's not talked about very much. We often talk about the physical appearance of psoriasis, but we don't always talk about the actual feelings and those physical sensations. And so this was an initiative that we were really passionate about working on, and we're continuing to work on at the moment as well. We've partnered with Celgene and also the British Dermatological Nursing Group on this. And so I'm just going to hand over to Amanda, who is a representative from Celgene, to start us off. And then I'll pop back up and tell you a little bit more about it in a few minutes' time.
Thanks, Carla. And it's really good to be here today. Can I just start with a question? It's really targeted at the people with psoriasis here in the room. How many of you find that itch is an issue for you? Okay. I thought we'd see similar sort of show of hands to that. First of all, if I just introduce myself, I'm Amanda Simonds. I work for Celgene. We are a pharmaceutical company with an interest in psoriasis and psoriatic arthritis. And Life's an Itch is a collaboration, as Carla said, between the Psoriasis Association, the British Dermatological Nursing Group, and Celgene. And the objective of this campaign is to raise awareness of the impact of itch on people living with psoriasis. And the trigger for this really was a study called MAP, which stands for the Multinational Assessment of Psoriasis and Psoriatic Arthritis. And that was a survey that was conducted a few years ago now, but covered nearly 3,500 people across the world living with psoriasis and psoriatic arthritis, and also included 500 healthcare professionals. Now, the good news for us is that actually 331 of those people with psoriasis were from the UK, and also 50 healthcare professionals. And the purpose of this was to explore perceptions and attitudes towards the conditions from both the people living with the conditions, but also the people treating the conditions. And it produced some quite remarkable findings. And I think the most remarkable one actually is relating to itch. When we asked people with psoriasis, what is the factor, the number one most bothersome factor of living with psoriasis? The overwhelming answer, and I appreciate it's a very small number there, but it says 35%. And this was the most popular answer, was itch. People saying this is the number one factor contributing to their most bothersome factor with their psoriasis. Yet when we asked healthcare professionals, only 4% of those healthcare professionals saw it as the most important symptom to treat. As you can see, the overwhelming amount said it was to do with the location of the plaques and the size of the plaques. And furthermore, this is another one that I think is also probably unsurprising to you, but again, I think quite an arresting statistic, is that well over half of people said that they don't actually regularly feel like an active participant during their consultation with their healthcare professional. So when I shared this with Carla and Helen, quite a while ago now, wasn't it? It really set us thinking, how do we actually improve that itch dialogue between healthcare professionals and patients? And so we launched Life's an Itch. And there are various components to this. The first is a healthcare professional survey, which we launched at the BAD Congress last year. And we've had over 250 respondents to that survey, consultants, nurses, and even a few GPs. We also launched the Life's an Itch website. Also, what we gave the people an opportunity to do was to upload words to the website to describe what your itch is like. And we had over 1,600 words submitted for people describing their itch. So I'm going to hand over to Carla, who's going to tell you a bit more about what we found out and what we've done with it.
Okay, so as Amanda said, we surveyed both healthcare professionals and people in the UK with psoriasis, and you won't be surprised to find that 95% of the people we asked who have psoriasis said that their psoriasis itches. So it is astounding, really, that we still have textbooks and we still have clinicians in the country who believe genuinely that psoriasis does not itch. Traditionally, not so much now, but I think in years gone by, it was taught that eczema itches and psoriasis doesn't. So obviously this 95% of people must all have eczema. The survey of healthcare professionals in the UK, however, did tell us that, you know, they do understand that itch is a problem. We can see that 62% said that their patients tell them that itch drives them mad. 73% said that patients have told them that itch is causing them sleep disruption. And 56% said that patients are very self-conscious about itching at work. So I think the tide is changing a little bit, and we do have dermatologists and GPs and nurses who are hearing these things from their patients and are starting to get an understanding of itch and psoriasis. Again, just looking into the results from people with psoriasis a little bit more, we found that 43% said that they don't talk to their doctor or nurse about itch. As Amanda alluded to earlier, we think that perhaps because it's a difficult symptom to treat, people focus on the visible symptoms. When you're sitting there in front of the doctor, you talk about perhaps how much psoriasis you have or where it is, and don't always necessarily think to talk about the itch, either because you're not asked or because you just don't see it as something that they can help with. 24% of healthcare professionals said that they're not proactively asking about itch. And 72% of people with psoriasis surveyed, said that they do find it difficult to describe how much their itch impacts on their life and what it feels like. And so again, we've got this communication barrier where it's actually very difficult to describe that feeling, and so it's perhaps very difficult to have that conversation with a healthcare professional, especially when they're not asking about it in the first place. Some good news, however, because 95% of the healthcare professionals, doctors, nurses, GPs, who we surveyed, do believe that itch is an important conversation to be having. So we need to see this number increase. They need to be asking more proactively about it if it's an important conversation to have. Now, as Amanda said, we asked people to submit words that described their itch, and on the back of that, we then provided these words to a number of artists in the UK who have produced some art pieces, some quite arresting, awareness-raising pieces that perhaps go some way towards describing how some people find their itch. And so you can see one of the sculptures is over there. I would encourage you to have a closer look at it if you haven't had a chance to before. But we also had a graffiti artist, an illustrator, a photographer. And again, you can find links to these pieces of art through our website, to the Life's an Itch website. They may not be relevant for everybody. We know that psoriasis is something that's very different for each person. Some people don't find that it itches at all. Some people maybe find that their itch feels more like this and not like that. This was merely a way of us trying to go some way towards helping that communication barrier and to raise awareness that the itch is an important thing for people with psoriasis. However, it was really important to us to not just raise awareness of a problem, but to try and go some way towards suggesting some solutions. And so one of the things that we've developed very recently as part of this campaign is a discussion tool. And this was developed in conjunction with the British Dermatological Nursing Group. And basically, I think we have got a few examples here today, actually, which may be better, easier for you to see than on the screen. But again, it's kind of a questionnaire format where you would mark whereabouts your itch is, at what times of day it affects you the most, if there's anything that seems to make it worse or make it better, how you would describe it. And you can also mark on there, a bit like a pain scale, a kind of an intensity of your itch. It's a very simple, on the scale of how much you've ever itched, is your itch at the moment the worst it's ever been, the best it's ever been, somewhere in the middle. And very importantly, on the back of that is a space for a plan of action. This tool is very much something that's meant to be used in an appointment. So both the patient and the healthcare professional to sit and discuss what the answers are, and to be able to talk about, okay, how do we go forward from there then? How do we improve this itch? Because although it is a difficult symptom to treat, there are some things that can be done, and it would be important to set that plan and then be able to come back at your next appointment in a month's time, 3 months' time, 6 months' time, and see if that's made a difference. So Life's an Itch is still ongoing. We're looking to launch this more widely to the media and in the press, and a general public launch in the next few weeks. The British Dermatological Nursing Group have their conference for their members coming up in a couple of months, and they're also going to have the art installations there and this tool there. So we're hoping that it will disseminate to nurses at least, and we will start to see the tool being used in clinic as well. But we'll keep you up to date. We've put updates in SO and on the website, and we'll continue to do so. And if anybody's interested, then please take a look at the pop-up banner down there and visit the website. Thank you.